Sakthi Dental Clinic, Mullukurechi. Periodontal surgery is a type of dental surgery that is used to treat periodontal disease, a bacterial infection that affects the tissues and structures that support the teeth. The goal of periodontal surgery is to remove diseased tissue and to restore healthy gums and bone around the teeth. The surgery is typically performed by a periodontist, a dentist who specializes in the treatment of gum disease and other disorders of the supporting structures of the teeth. Periodontal surgery can involve several different procedures, depending on the extent and severity of the periodontal disease. Some of the most common procedures include 1. Scaling and root planing. This non-surgical procedure involves removing plaque and tartar from the tooth surfaces and smoothing out the root surfaces to promote healing. 2. Flap surgery. This surgical procedure involves lifting the gum tissue to remove diseased tissue and to clean and reshape the bone around the teeth. 3. Soft tissue grafting. This procedure involves taking tissue from another part of the mouth and transplanting it to the affected area to promote the growth of healthy gum tissue. 4. Bone grafting. This procedure involves placing bone graft material in areas where the bone has been destroyed by periodontal disease. Periodontal surgery is typically performed under local anesthesia, and patients may receive sedation to help them relax during the procedure. After the surgery, patients may experience some discomfort, swelling, and bleeding, but these symptoms should subside within a few days. Patients will also be given instructions on how to care for their teeth and gums after the surgery to promote healing and prevent further periodontal disease. Thanks for watching. Like and subscribe.